to bring a recommendation from our Bladen County Health and Human Services Advisory Committee for 2 new positions in the Child Protective Services area.
So I sit on the health board, and I'll give you a couple of things here. There was, when I read this here, and I'll give you a couple of things here. There was, when I read this here, I had to ask them if it's true. They're overworked over there. They've got more caseloads than they can handle. And one of them's going to be a full-time, both of them full-time, one of them's going to kind of handle nights and weekends to eliminate, I think, about $12,000 overtime we paid last year. I understand the state can pay up to 75 and maybe can pay more, so the county would be 25 or less for these 2 workers. And in April 2021, there was an 8-month-old and a 2-year-old that was unresponsive, and they took them to the hospital and gave them Narcan. I mean, that's the protocol for these things. And you know, we have an opioid task force or substance misuse, substance abuse, and I wasn't even aware of this. When I read it, I asked them, I said, am I reading this right? So that right there made my mind up that we need 2 more workers, but we can't do it enough. But we're going to lay on the table for this morning. So anybody questions?
How many workers do you have now?
Currently, we have 6.
You have 2 more?
Yes, sir.
Is that, do they run in conjunction with the foster care program to help assist with that? Or what do they assist with? I'm asking, what do they?
Child Protective Services, they accept reports of abuse or neglect or dependency. They investigate or assess if there is a need that the family cannot keep the child safely in the home. A petition is filed through the courts, and it does move to foster care.
Well, imagine at one time we had a boom on foster care. Is that what we're having now? A boom on foster care?
It's slowly rising there, but there is an urgent need in Child Protective Services based upon the numbers. There has been a 40% increase this past year with our cases.
Mr. Bullock.
I've got a question. Would 2 employees in this area be sufficient for you?
Yes, sir.
We feel that it will bring us, our goal is to decrease the tasks, the workload. Where, if you read in the letter, that last year we had a 100% turnaround in Child Protective Services. That's a lot of time training, trying to get someone seasoned to where they need to be to make the correct decision.
Okay, thank you.
I just have a question. I know you have these increases, but a lot of it, if you look on the news, COVID, the pandemic last year, put stress on people, but that's no excuse for neglected children, period. I don't care what you say. But at the same time, look at the numbers of children that are dying, and it's unreal.
So this is on the table for discussion and action at the next board meeting.
I just got to list that picture.
Okay, go ahead.
So, are these permanent positions?
Yes.
So there, the county has received a grant, and that's all I'm saying about it. And my understanding is through that grant, there'll be some training for these child protective workers and stuff. So there's a lot to come with this and help these child protective service workers be more effective. So we'll put it on the table, it'll be on the agenda for next month to vote on it. Thank you, ma'am.
Yeah. Give them the money.